Hi doctors. This week along with PSM we are going to discuss about some of the important notes from gynecology, and today's session is about anatomy of female pelvic organs. And female external genitalia, which includes vulva, which means mons pubis, labia majora and minora, vestibule and etc. And now we are going to see some of the homologous glands in males and females. First, labia majora, which lie on either side and join posteriorly to form the posterior commissure, which is homologous with the scrotum of the male. Labia minora, which is a thin fold of skin which is homologous to the ventral aspect of penis, and it does not contain any hair follicle. Next comes clitoris. This is homologous to penis. And Skene's gland. Skene's gland is a paraurethral gland which is homologous to prostate glands in male. Bartholin's gland, and Bartholin's duct usually opens in vestibule, and this is homologous to the glands of Cowper's gland in male. Next, what is caruncle myotiformis? This is most important MCQ which have been many times asked in the exam. That is nothing but torn hymen. Usually during childbirth, hymen is extremely lacerated. Later, which will be represented by cicatrized nodules, that is known as caruncle myotiformis. Now, blood supply to the vulva is mainly by internal pudendal artery, and nerve supply is from pudendal nerve. So pudendal artery and pudendal nerve. Lymphatic drainage of vulva is to inguinal nodes. And the most important point, lymphatic drainage of clitoris is different from vulva, which is lymph node of Cloquet or Rosenmuller lymph node. So lymph node of Cloquet or Rosenmuller lymph node for clitoris. Now the embryological development, this is also most important. Clitoris is from genital tubercle, labia majora, labioscrotal swelling. This one we can easily remember because labia majora is a homologous organ to scrotum in male. So labia majora, labioscrotal swelling. Labia minora, genital fold. Vestibule, urogenital sinus. And coming to vagina, upper part and lower part, both are different. Upper part, which is above the hymen, which is from Mullerian duct or sinovaginal bulb. Mainly muscular part is from Mullerian duct and the mucous membranal part from sinovaginal bulb. And lower part of vagina is from urogenital sinus. So vestibule and lower part of vagina both are from urogenital sinus. Labia majora, labioscrotal swelling, labia minora, genital fold, and clitoris, genital tubercle. Next comes some important points from vagina. As we have already discussed, upper part of vagina is from vaginal bulb or Mullerian duct, and lower part is from urogenital sinus. And this vaginal canal is directed upwards and backwards, which forms an angle of 45 degree in horizontal plane. And vagina is H-shaped in transverse section, and vagina has 4 fornices, anterior and posterior and 2 lateral. And here the anterior one is shallowest and the posterior one is deepest. And the vaginal epithelium is non-keratinized stratified squamous epithelium, and vagina has no mucus secreting glands. So vaginal secretion is derived from endocervical gland and endometrial glands and Bartholin's gland. It has no mucus secreting glands. And lateral wall of upper third of vagina is very sensitive to hormonal influence. So for hormonal cytology, vaginal smear should be taken from lateral wall of upper third of vagina. Next comes important MCQ. What is the vaginal pH? It varies from time to time. Before puberty and after menopause it is 7, and puberty to menopause it is acidic, which means 4 to 5. So 4 to 5 during puberty to menopause, but before puberty and after menopause it is 7. Why vaginal pH is acidic from puberty to menopause? Because of the borderline bacilli, which is the gram-positive lactobacilli that produce lactic acid from glycogen, which is present in exfoliated cells. So pH is acidic from puberty to menopause. Next comes uterus. Normal position is anteversion and anteflexion, 90 degrees anteversion and 120 to 130 degrees anteflexion. And uterus is usually inclines to the right, which means dextro-rotated, but cervix is directed to left, which means levo-rotated. So uterus dextro-rotated and cervix is levo-rotated. And coming to the measurements, uterus measures totally 8 cm long, 5 cm wide and 1.25 cm thick. Next comes some important point. Weight of non-pregnant uterus is 50 to 80 gram, but pregnant uterus is 1000 grams. So weight of non-pregnant uterus 50 to 80 gram and pregnant uterus 1 kilogram. Similarly, length of non-pregnant uterus 8 cm but pregnant uterus 35 cm, and capacity of non-pregnant uterus is 10 ml but pregnant uterus is 5000 ml, which means 5 liters. 10 ml pregnant uterus, 5 liters. Next, as we know, uterus consists of body, isthmus and cervix and etc. And body of the uterus contains 3 layers. There is no submucosal layer, but it has endometrium, myometrium and perimetrium. Endometrium is lined by ciliated columnar epithelium. Coming to myometrium, it has 3 layers: outer longitudinal, middle crisscross and inner circular. Middle crisscross is a figure of 8. This muscle fiber looks like figure of 8, and this middle layer of myometrium act as a living ligature during involution of uterus, and it prevents mainly blood loss. Next, coming to cervix. Endocervix is lined by simple columnar epithelium, but exocervix, which is vaginal part of cervix, that is lined by stratified squamous non-keratinized epithelium. And corpus cervix ratio. This is also important MCQ. Before puberty, this is 1:2 ratio. At puberty, 2:1 ratio. In adults, which means in reproductive age group, this is 3:1 ratio. So corpus cervix ratio before puberty 1:2. At puberty 2:1, reproductive age group 3:1. And the blood supply to uterus is mainly from uterine artery and ovarian artery. Uterine artery is a branch of anterior division of internal iliac artery, but ovarian artery is a branch of abdominal aorta. And venous drainage is internal iliac vein. Coming to nerve supply, motor supply from T5 to T6, sensory is from T10 to L1. Lymphatic drainage is varies from fundus to lower part of cervix. Next comes a fallopian tube. Fallopian tube is present in upper free margin of broad ligament of uterus. It is 10 cm long, and it is lined by ciliated columnar epithelium. It has secretory peg cells, which are mainly present in proximal part of tube. Next comes blood supply. Uterine artery and ovarian artery. Uterine artery supplies to medial 2/3 and ovarian artery to lateral 1/3. And lymphatic drainage mainly into para-aortic nodes. Coming to the parts, the important features: intramural or interstitial part of fallopian tube. This is the shortest and narrowest part of fallopian tube. It acts as an anatomical sphincter. Next comes isthmus. This acts as a physiological sphincter because it is due to circular smooth muscle and adrenergic innervation. This is the most common site for ligation, which means for tubal ligation. Ampulla. Ampulla is the longest and widest part. Mainly fertilization takes place here. So this is the most common site of ectopic pregnancy. So shortest part intramural, longest and widest part is ampulla. That's all today. Thank you.